I am um, grateful to have some wonderful partners with me helping to support this training effort today, as we have always. Today, we're going to be interacting quite a bit. And so there's going to be some opportunity for us to have some dialogue and inclusion. And so, in that mind, I'm going to ask my friend, Dave Clausen, if he wouldn't mind sharing with you a little bit about some of the Zoom functions, just so that we might be able to make sure that everybody's able to participate fully when we ensure that we're doing some things. So Dave, if you wouldn't mind, please share that information for us.
Yes, indeed. Time for a quick little Zoom tour. So in the bottom left-hand corner of your screen, you can see the mute, unmute button. Feel free to be ready to use that today. Stephanie's going to be asking for you to share your voice and having just a great conversation. Then next to that, of course, is a video on-off button there too. We do love seeing your smiling faces. So if you're able, willing, and comfortable, we'd love to see you on camera. Then also when you move across the bottom of the screen, you can see that participants button. When you click that, you can see the list of everybody that's here with us today, because prevention is better together. Then next you'll have the chat button. That opens the chat box in the bottom right-hand corner of your screen. I'll be hanging out in there today, and it's a-okay to talk during class in the chat box. That's what it's there for. And then the last two things I want to point out would be the top right where it says view. That's where you can change between speaker view, gallery view, how big the slides are, how many webcams you can see at once. So feel free to play around with that and find the layout that you like best. Lastly, I'm not sure if we've got it in tail for you or not, but we may be using the Annotate feature at some point. So to access that, you'll hit the view options at the top of your screen there where it says view options. Then the third option down is the Annotate feature. That will give you a control panel where you can select how you want to annotate. And that is your quick Zoom tour. If you have tech difficulties at any time, I'll be in the chat box and just send me a message. All right, back to you, Carlton.
Thanks, Dave. I'm really grateful for the opportunity of having our team together to share this information with you all today. All of this is made possible because of the great leadership from the Department of Health and Division of Behavioral Health there in the state, and the extraordinary work that they provide, and of course the wonderful technical assistance that is being provided and who's been quarterbacking for us. And that quarterback is just a reference to the NFL draft that we all probably stayed up much too late watching yesterday. By the LCPR and the great work that they're doing. I am so grateful for their leadership. And so with that, my friend Paula, do you have a bit of a welcome and a setting the stage for us, please?
Yes, just a few words. Good morning. For the people that don't know me, I am Paula Carrero, the program coordinator for the LCPR, the Louisiana Center for Prevention Resources. We welcome you guys this morning, this Friday morning. It's a little bit like raining throughout the state, but I'm very happy that everybody took their time to be sitting here with us today. It's great information that we're gonna get today from Carlton team. Thank you, Carlton, and the rest of the team. I just have a few things to say about the trainings. You can check all the trainings that the LCPR is providing for the next 2 months on the website. So we're gonna provide the website for you guys on the chat room. One little detail that I would like to say about the CUs, when you register for this training, please make sure that you include your ADRA number on the registration so you can get your certificate with your CUs. Otherwise, you're gonna get a participation certificate. If we don't have that information, you cannot get your CEU. So it's up to you to provide us that ADRA number. If you have any questions, please feel free to chat with me in the chat box or send me an email. And check the upcoming events on the website because we have all the trainings listed in there. Saying that, thank you, Carlton. The floor is yours.
Thank you so much, Paula. And again, thanks to all that's been involved with this. I want to make sure that folks are aware that that some of the resources may be coming from the Substance Abuse and Mental Health Services Administration, and as such, they are not held liable for any of the things that we are offering, and do not particularly find themselves endorsing our words. I wanted to just ask, Dave, I'm noticing some things on my end. Am I coming across okay, or is my video or audio off?
Your video will get a little choppy, but your audio is coming through loud and clear.
Thank you. I'm going to press forward then. I am so grateful to have my dear friend, Stephanie Strutner, to co-lead this training with us today. She's going to take us forward in an environmental approach towards addressing alcohol and other drug misuse there in our states, and how prevention leaders think about that. It has been my extraordinary privilege over the last 25 plus years to have had an opportunity to work with some of the leading thinkers in our nation around prevention and prevention efforts, and to bring some of those lessons learned and that information and some of that expertise to bear in this course of creating a team that will provide the most effective and efficient information possible. I am grateful to both Stephanie and Dave for being a part of the delivery of this training. Both are prevention leaders, national prevention leaders in their own right, and it is my privilege to be able to have them as partners on this endeavor. And so I want to go ahead and share with you, we're going to talk a little bit about the differences in individual and environmental strategies. We're going to speak a lot about those principles that are all involved with this environmental approach, and what does that mean on behalf of prevention leaders. And we'll look at ways in which you might look at some promising new environmental strategies. And throughout all of this, as Dave mentioned, we're looking for you to be as interactive as possible with this. But I'm going to start this off with a bit of a mental set, if I could. I want to share with you, if we had a dog here, right, and our dog had fleas, there are a couple of things that we could do, right? If our dog had fleas, what approach would you use? Would you wash the dog or wash his house? And if you wouldn't mind, go ahead and put your answers in the chat. Which of these approaches would you use? A, washing the dog. B, washing the house. And Dave, when you see them start to populate, please let me know.
It is a chat waterfall. Both, all the above.
Got it.
They got it.
You guys are exactly right. You're exactly right. But what this actually represents is, it represents the fact of how we approach prevention, and the reason why we're having this conversation. As prevention leaders, we are bringing the public health model to bear on behalf of helping communities create and think through how they might problem solve on behalf of the substance misuse issues within their community. And in doing so, looking at the public health model, we understand that there are three components towards any population-based substance misuse issue. The first is you have the agent, right? And the agent is representative of the drug itself, or the issue, or the virus itself. The second is the host, right? And you can't have a problem unless a host interacts with the agent, right? And at that point, you have an individual level problem, which is why treatment efforts are so vitally important. But you don't yet have a population-based problem or population level problem unless you also bring into play the third component, which is the environment, those conditions, those factors, those influencing conditions or characteristics that serve to bring the host and the agent together. When we think about the dog and our dog scenario, we have the issue of the fleas being the agent and the dog being the host. But unless you also took care of an environment, you might have washed that dog thoroughly, but if you put him back into a flea infested doghouse, you would still have an issue, still have a problem, which is why we still need to deal and address with both individual based and environmentally based strategies, as we're going to discuss. And so this holds true whether we're talking about substance misuse or even as we've all been living through this past year and a half. We can think of examples of that with respect to how this comes into play in terms of the way we're living. With that, I wanted to kind of give present a picture of what it is that we're talking about when we talk about environmental strategies and the approach. It is not difficult, but it does require us to think concretely about this. And so Stephanie is going to take us through that conversation. And with that, I'm going to introduce my friend Stephanie and allow her to share her screen and take us forward with a conversation as we dive into this a bit deeper.
Thank you, Carlton, and morning to my friends in Louisiana. And it's great to be with you again. I had to look back at my calendar to think about the last time we were together, and it was just 2 weeks ago today. It feels like it was months ago in many regards. So it's nice to be with you again and to see your faces. And y'all, I gotta say, I'm jiving with your family feel on this call today, and I want us to keep going with that. So let's carry that on and let's keep this informal and interactive. I want you to feel empowered to, at any point, if you have something that you want to add or if you have a question that you want to ask, please feel free to unmute and you may interrupt me at any time. It won't throw me off my game. I want to make this, and Carlton and I have a similar feel, and we want to make this really exactly what you want of it. So please make sure to engage in dialogue with me and ask those questions. You can also use the chat box. And Paula, I'm sorry that it's rainy in Louisiana today. I'm going to send you some East Tennessee sunshine. I'm going to telepathically send it down to all y'all so that we have a great training this morning. And so we're talking about environmental strategies. And Carlton used a great analogy with the dog and the fleas. And so we want to just take a step back to our theoretical framework. And so this definition is provided by SAMHSA, but we're really talking about those prevention efforts that are aimed at changing or influencing the community conditions, those norms, the standards, the institutions, even the structures and systems and policies that we have in our communities that contribute to substance use and its consequences. And so if we have that definition in mind as we move forward, it's important that we understand the difference in individual and environmental strategies. And so I'm going to take us off a screen share for just a second because I want to be able to see you and see everybody at once. And you can use a reaction or you can just give me some nonverbal. How many of you are well versed in the utilization of environmental strategies? Okay, I'm seeing a good number of hands, so that's really great. Looking to you all to provide your experience and your expertise here as we continue along with this conversation. And so again, when we think about environmental strategies, one thing that's really important is recognizing, if you were with us 2 weeks ago, we talked about this idea of having a combination of strategies that complement one another. Because it's very unlikely that we go out in the community and we do one thing, even if it's an environmental strategy, and we change the behavior of every single person in our target population. And so we want to be mindful as we're thinking about environmental strategies of how strategies complement one another and how we use them in collaboration to make sure that we're reaching every member of our target population. And so when we think about the difference between strategies, we have, as you all probably are aware, different levels of strategy. So we have strategies at the individual level, and these strategies affect a person or could be multiple people, but we're working toward that individual, whether it be in their school environment, within their faith community, among their peers, or even within their family, there are strategies that we can do to reach the individual. But here's the thing. If I'd say that most of you, if you're in prevention, you've done some sort of effort at a school. We can go into a school, and even if it's a huge school, let's say we've got a school that has 2,500 kids in it, we have the ability to reach 2,500 kids. But if there's 15,000 young adults and adolescents and children in our population, then we're only reaching a small fraction of those people. And here's what really matters. When they leave that educational experience, they still have to go into the real world where they're faced with risk and protective factors, and sometimes facing access of substances, and they're forced to make a decision. And so the individual strategies, while important, can't be the only area of focus. That's why we have environmental strategies to support those. So we know those individual strategies reach people through providing information, also building skills, and providing support. All of these at the individual level, but still that individual must leave that environment and go out into the real world and at some point be confronted with a choice. Our environmental strategies are those that achieve change and are able to work on systems in our communities. So perhaps regulations of different substances or different laws and policies, availability of drugs or alcohol or other substances, the norms that surround the use or the lack thereof of some of these substances. And so these environmental strategies affect the systems, the regulations, the policies, and the norms in which we all live. And so when we think about how we use environmental strategies, we're able to engage in those strategies like modifying access or changing barriers. Sometimes that's implementing barriers when it comes to accessing drugs. It might be reducing barriers, like barriers to effective protective factors or other opportunities that help to lessen the likelihood that someone will engage in risk behaviors associated with substance use. We can also change the consequences, and sometimes this might mean adding negative consequences for engagement in risk behaviors, or it might be adding some sort of incentive for making the healthy choice or engaging in healthy behaviors. Some examples of access or barriers might be offering scholarships to responsible alcohol sales classes in the community, or providing at-home medication lock boxes to parents or grandparents. We think about changing consequences, we might provide incentives for community members to volunteer or increase fines for outlets that are selling alcohol to minors. We also have the ability to change the physical environment, the physical design of the environment, where we install permanent medication disposal bins so that people have better access so that they can properly dispose of their prescription medications, or installing signs at the park that help patrons recognize that they cannot smoke here. This is a smoke-free environment, and there's a penalty associated with your use of smoking paraphernalia or smoking devices in that park. Modifying policy, of course, is a great way for us to reach a large number of people in our community by, let's say, mandating responsible alcohol sales classes for store clerks who sell alcohol, or passing a policy with an insurance carrier to offer coverage for non-opioid pain treatments for acute pain in lieu of opioids. So these are just some examples of environmental strategies, but the real take home here is we're working on strategies that affect that collective environment, not just the individual, but really many, many people, and in some cases, all people within our target population. So again, if we break down those strategies, we have the individual strategies that are providing information, building skills, providing support. These are the strategies that work toward change within one person. They can often take a lot more time of our volunteers and our staff. They can sometimes be more costly, but sometimes they're easier for us to come up with, especially if we're not good at articulating exactly the behavior associated with our local condition. Our environmental strategies, though, are a lot easier to come up with if we are clear, specific, identifiable, and actionable about that local condition, and we're really identifying the who, the what, the where of what the behavior is that's happening in our community, so that we can come up with strategies like changing access or barriers, changing the consequences, changing the physical design of the environment, and modifying policy so that the healthy choice is the easy choice. And in many instances, it's whether they want to make it or not, the systems in our communities are set up so that the healthy choice is the obvious choice, and it's the easiest choice for people to make. Let's dig into the principles of the environmental approach and why do we do it this way? And so the environmental approach is really, again, designed to impact every member of our target population. The idea here is to change the culture and the context within which decisions are made. Again, so that the healthy choice is the obvious choice, the easy choice. We're focusing on creating system level change here. And so, as you might imagine, these environmental changes might not cost very much money, but sometimes they cost us time, because sometimes we have to identify the community readiness. Where's the community with respect to the changes that we're proposing, and how long is it going to take us to prepare the soil, if you'll allow me to use that analogy, in the community for us to move forward in initiating some of these changes, so that we're targeting community level risk factors. The environmental approach, Carlton used a great example with the dog and the fleas. I have always thought about fish. So one of my girlfriends has 2 kids, and they have been begging for a dog. And so her solution was, we're going to get the kids some fish. So they got a fish tank and they filled it with fish, and one by one, those fish were getting really sick. And I don't know if any of y'all are fish people, but they got the ick. That's a technical term for fish. So they got the ick. And it's a sickness that the fish got. And so they were taking the fish out, and they would have a little special container for the fish, and they had different things that they were doing for the fish. But y'all, all those fish were dying. You know how terrible that was for those little kids, and they had these burial stones for all these they had tetras. So they weren't even, they were like 3/4 of an inch long, tiny, tiny little fish. But still, those fish meant a lot to these little kids. And so one by one, they just kept losing all of these fish. But they were working really hard to treat those fish. But the fact of the matter is, the reason all those fish got the ick was because there was a problem with the water. And so after all their fish died, they figured out that they had a problem with the water. And in order to get new fish, they had to go in and they had to treat the water. That's what we want to do in our communities. We want to treat the norms. We want to treat the policies. We want to treat the customs, the practices in our communities to make them healthier, to make them safer, so that people, adolescents especially, can make healthy choices, and that the healthy choice is an easy choice. So if those fish are swimming around in contaminated water, they're all going to continue to get sick. But if we clean up the water, we don't have to expend our resources on treating all of those individual fish. We treat the water, we treat all the fish. So that's what we want to do. We want to treat our communities so we treat all the people in the community at the same time. In order for us to do this, and in order for us to be effective at our environmental approach, we have to be really clear on our local conditions. We talked about local conditions when we were together 2 weeks ago, and so we want to use that concept to carry forward today. And when we articulate those local conditions, as I mentioned, as very specific, things that we can do something about, and the very specific tangible behaviors that we see, the who, the when, the what, the where, that gives us the opportunity to tie our strategies directly to those local conditions so we can do something about it. Because let's take, for example, if we say that youth are using marijuana in the park, then we might be able to say, okay, well, we can increase police presence in the park and foot patrols and police cars driving through. But how big is your police force? And do they have the human power and the funding to be able to do that? Or if we were to say youth use marijuana in the park after Friday night school events, then that gives us a specific time window into where and when that behavior is happening so that we can do some enforcement around that specific time. So we're utilizing resources more effectively, we're targeting our local condition much better, and we're more likely to institute a change. And so when we think about the environmental approach, not only do we want to be very specific in how we tie to our local conditions, we also want our strategies to be comprehensive enough to change the local condition, and then thereby comes that domino effect. We change the local conditions, then we're changing those root causes, and those root causes changing our problem. In order for our strategies to be comprehensive enough, we have to have the right dose. So let's go back to my friend's fish tank where the fish had the ick. If she had a 50-gallon fish tank and she just put 2 tiny little droplets of solution into the water, is she going to have enough dose of that solution to change the pH of the water? Probably not. If she had a 3-cup fish tank, maybe it might be enough, but she needed 3 cupfuls of this solution to change the pH of her water, to change the environment of that water so that the fish didn't get the ick. So when we think about our local conditions and our strategies, not only do we need comprehensive strategies, but we need enough dose of those strategies to make sure that we're doing enough to initiate change within those local conditions. And so when we identify these strategies, we want to make sure not only that we have enough of the strategies, but they coordinate with one another. So making sure that, for example, if we're coming up with a policy change, we're also teaching people about that policy change, and we're building the skills of the people who will be enforcing that policy so that they know how to do it. And we have this comprehensive effort in making sure that our strategies work with one another and that we're not just instituting policies, for example, that cannot be enforced. We also want to be mindful that our strategies reach all the people in our target population. And so this becomes really important in our planning phase because we want to be really mindful of who's at the table when we're planning. It goes back to, I've always thought this mantra, nothing about me without me. Nobody wants you to sit and plan for them. They must be part of the process for it to be effective. And so in order for us to reach all the people, we have to have representatives of their niche in the community at our planning table. Otherwise, we might miss them because of a language barrier, or we might miss them because our target or our message is just really off point. I'll give you an example of this. When I was coalition director at a coalition in East Tennessee, the school system, we had a great partnership with our school system, and they came to us and they said, we really need the coalition's help. Our students are using smokeless tobacco in the school, but they're spitting it out in the toilets and it's clogging the toilets. And we've got to get this problem solved. Can you help us? And we said, oh yes, in our infinite wisdom as the coalition, we will come in, we will help you reduce the prevalence of use of smokeless tobacco in the school. And so our adult coalition members came up with a well thought out campaign that looked really polished and nice, and it got hung up in the school and it was all super saturated in the school, and nothing changed. Why did it not change? Because we weren't wise enough to include the student population in our planning, and the campaign didn't resonate with them. So when we went back and tossed it to the students and said, all right, Youth Coalition, can y'all come up with something? They came up with a campaign, and when I looked at it, I literally thought in my head, this is awful and it is not going to do anything. They were using emoticons from their cell phones. I mean, they pretty much created the campaign on their cell phone. And I thought, this isn't going to do anything. But it was the biggest hit for the student population, and it made immediate change because it resonated with their students, with their peers. And so if we want to reach all the people, we've got to include those members in the target population in our planning, and also respecting the different cultures, the different subpopulations within our population. And so let's look at some sets of comprehensive strategies as an example. So if we take a local condition that locally owned retail stores sell beer and malt beverages to minors without checking ID, of course, this would tie to the root cause of retail accessibility and the problem of underage drinking. We could provide information by giving store managers information on the consequences of selling to a minor. We could build skills by training store clerks on civil liability of selling alcohol to a minor. We could enhance services and support by providing point of sale and age verification materials to that retailer. All of those things are at that individual level, mind you. And so thinking about how many on-premise, off-premise retail outlets do you have in your community? How many materials are you going to have to get out to those people? The time it takes for staff and volunteers to get those materials prepared, ready, and distributed to all of the outlets. Pretty time and financially intensive. If we look at the environmental strategies, modifying access or barriers or opportunities, we can support the stores in utilizing point of sale software at checkout. So they're scanning IDs, and it cuts out the calculation that a store clerk has to do in their head, and the computer does it for them. Or collaborating with law enforcement to conduct regular compliance checks. And I'm talking about the compliance checks that are on a regular basis but not hitting everywhere at the same time, so that the store phone tree doesn't start going, and the first store that's checked picks up the phone and calls the next store down the road to say, hey, law enforcement's coming, and they call all the stores, and so the first place fails, and then you have this bright, shining, wonderful looking report that everybody was compliant with underage drinking laws in the compliance checks, meaning the compliance checks are set out in such a way that the law enforcement go to a few places on one time and a few places another day, so that they get a real true snapshot of what compliance with underage drinking laws looks like in that community. Changing consequences might look like instituting tiered sanctions for non-compliant retailers. So if you consistently are non-compliant with underage drinking laws, that you don't just get a slap on the wrist and a $250 fine. The stores in my community are making way more than $250 a day by selling alcohol. So if you come in and fine them $250, that fine doesn't meet the crime. So we want to have instituted sanctions so that, okay, if you slip up and you sell to a minor once, this is your penalty. But if you do it again, then that penalty is higher. And if you do it again, that penalty is higher, and eventually you could lose your license to sell alcohol or beer because of those tiered sanctions. Changing the physical design of the environment might look like placing alcoholic beverages inside a cooler, behind a door, and separated from non-alcoholic products, so that you have to go to a specific area of the store that might be mirrored so that the clerks can see what's happening in that area of the store. Or it's away from the kid drinks where kids are commonly passing by to pick up something for themselves. And moving those alcoholic beverages inside a cooler, and not at a little stack or kiosk next to the door where somebody could easily grab a single and stick it in their pocket, or grab a case and just walk out the door with it. We have them in an area that's less accessible in the store. So physical design for beer and tobacco and drug paraphernalia sales, especially in stores, can really affect how youth are accessing those products. Modifying policy, like passing a local ordinance to mandate responsible alcohol sales training for all store clerks. So depending on state laws, some states require that people who sell liquor be trained, but not everybody who sells beer always has to be trained. And so making sure that there's consistent training for store clerks, but also that somebody is checking to make sure that the store clerks have had their training and that they're maintaining it. So this is just an example of a set of strategies, but as you see how these work together, passing local ordinance mandating responsible alcohol sales training ties to enhancing skills of actually providing that training. So in the community where I worked, we got a regulation passed, a local ordinance passed, that all store clerks had to be trained in responsible alcohol sales training. But at that time, nobody in our entire county offered that class. And so in order to get that policy passed, we had to have staff and volunteers trained to make sure that it was accessible for people in the community to be able to have that class. And so thinking about how these strategies are mutually reinforcing, how they work together to make the whole process comprehensive. Let me pause here for just a moment and see if you all have any questions or comments that you'd like to add.
Hey guys, questions or thoughts?
All right, well, I won't force you, but I do encourage you to participate in discussion today. I doubt everybody wants to sit there and be talked at by me all day. So please engage in conversation with us when something pops into your mind. Feel free to interrupt me. And Carlton and Dave, if anybody engages in conversation in the chat box and it's appropriate to mention to the entire class, please stop me.
Dr. Harrison, did you have something?
Yes, Stephanie, I have a comment. We had a situation almost what you were talking about in our park, which is 14 acres directly behind our center. When we first moved there, it's a brick park, but they didn't have any signs saying that alcohol was prohibited. And then we had an influx of Latinos moving into the community. And so they were using alcohol, but there were no signs saying that you couldn't use it. And so then we start working with Breck, who first we had to put the signs, but we also had to have them both in English and Spanish. And so then there was a question of who was responsible for enforcing the policy. Was it the park monitors or was it the sheriff department? So one superintendent said it was the park monitors, but they didn't have like a change. So like if the park monitors reported it, they didn't have like to say reported to whom and then what happened, what were the consequences. Okay, so that superintendent left and now we have a second superintendent, and that superintendent now agrees is the sheriff's responsibility. So, you know, what I wanted to say is that it's not only working, you were talking about like the different skill levels, but it's also working with different components of the community to enforce the laws that are there or the regulations. Yes.
Thank you so much, Dr. Harrison. That's such an important point. And when you mentioned the cultural appropriateness of our strategies, which we need to continuously make sure that we're monitoring and following through with, but then also a policy is only as good as our ability to enforce it. We can't, you know, some coalitions might go out there and some entities in the community might go out there and get a policy passed and feel really strong about it, like they've done a great job. But if we don't have anybody to enforce the policy and or the community readiness aspect of whatever the issue is not to the place where the even if we do have an entity who's supposed to enforce it, if the community readiness is not there that they will enforce it, then we also have a barrier. And so when we engage in these environmental strategies, that's how we have to make sure that we have these complementary approaches working together. So when we're thinking about policy, not only do we have policies that are enforceable, but we have the entity defined who will enforce those policies. And in addition, we're providing training to them so that they know how to enforce the policies. And then maybe there's some sensitivity involved as well, because, you know, I hear you saying that you had a Latinx population move into that area, and because there was no signage, they were using the park to engage in alcohol use. But also, that might be tied to some cultural norm that they have. And if we just pop right in there and start arresting people for drinking in the park, then we might have a real cultural rub on our in front of us. And so
You know what, Stephanie, that was really considered, because we said that we did not want any arrests, you know, say like for a year. It was just to educate. And then after that, we would start actually enforcing.
Exactly. And thank you for that note. I believe, and I've seen a shift just in my time in prevention, which has spanned about 17 years. I've seen a shift from the punitive enforcement that we have historically engaged in to now being a bit more trauma informed, at least, and then a bit more sensitive to how through enforcement we have created some racial disparities, and we have targeted some racial minority groups. And so I think that we also, while we're being mindful of policy change and recognizing that policy is a significant piece of effective environmental strategies, we also must be mindful of the cultural appropriateness of that. And then also doing a risk assessment of what are some of the unintended consequences of these policies in our communities. Because even with the best of intentions, we can sometimes create policies that continue that divide, that create disparity. And so I would never want to do that. I think as a collective group, I can say that we would not want to do that as preventionists. And so it's also critical that we don't just sit at a table and say, "Ooh, we've got a new policy idea," and we go and enforce it. No, we think about what will this policy do, and what are some of the effects that this policy will have, and are there unintended consequences that we haven't considered? And so anytime we think about policy, crafting policy, and adopting policy, whether it be at the local level, the state level, or the federal level, these are all considerations that we must make. And thank you, Dr. Harrison, for giving us pause to have this conversation, because I do think it's really important. Carlton, I know you have a great deal of experience in this arena. Is there anything that you would add?
Can you guys hear me well? I'm dealing with some technical issues on my side, so I've been trying to stay quiet. If you can hear me, I would just simply say that the environmental approach that Stephanie has been bringing to us needs to be considered from a standpoint of making sure that we are affecting and impacting the entirety of the population. The difference in our mindset when we're thinking about environmental strategies is that we're looking at impacting the entire population with respect to the strategies that we're using. It's kind of getting the biggest bang for our buck, so to speak. And I sort of look at it like finding the thermostat in the room. If you change the thermostat, you change the conditions for everybody, right? With that one strategy, right? Well, all the things that Stephanie is taking us through is kind of like finding the thermostats within our communities. What are those things that with subtle efforts, we can make a change that will impact the entirety of the environment? And if we're not doing that, and if we're not doing that in a culturally appropriate way, then we may be missing some things. And so that's the richness that I think that's involved with some of the things that you're sharing, Stephanie.
Thank you, Carlton. Great value added there. And again, great conversation. I want us to continue to do this. So please continue to engage in this dialogue. And Earl, I see your comment about compliance checks. and how you were able to collaborate with the Sheriff's Department to enforce those compliance checks. So well done on that. And Shanika has a question for you, Dr. Harrison, asking, was it difficult for the police in that area to understand the culture at that park and not be quick to arrest?
No, and it wasn't, because we have community police officers in our community. And so we had been working with them even before this issue came up. So it was not a problem, and we all were on the same page.
That's really a great point, and I'm thrilled to hear that. One thing that pops in my mind hearing your answer to that, Dr. Harrison, is when I was in graduate school, we went through a process called MAP. It's a public health process, mobilizing through action for participation in products. And the MAP process, one of the components of the MAP process is planning for planning. And when I was a graduate student, I thought, planning for planning, my goodness, how many bureaucratic circles do we have to create for ourselves? But I get it as a practitioner, because if we don't plan for planning, to your end, Dr. Harrison, we wouldn't have had those trained community police officers to understand the cultural norms, to understand the sensitivities that we have to engage in, to understand the community as a whole. And so when we plan for planning, coalitions and community planning agencies do this all the time, because we plan for not only our strategies, but we plan for how to implement those strategies and how to be inclusive in the planning process. And when we do each of those things, we're able to identify the areas of training, of skill building, of support that we have to engage in to make sure that when we get to those environmental strategies, especially those policy pieces, that we've already groomed the soil, if you will, for some of those other areas that we have to fulfill.
Yeah, and I just want to make one comment since you said that. We had groomed the soil until the sheriff gave us a Latino police officer.
Beautiful.
Yes, and so important that especially when it comes to enforcement, that we have somebody in there who looks like the target population. You know, I could go into many areas in my community and be very well accepted as a leader or a subject matter expert or as a person enforcing rules. But if I went into some different areas in my community, I am probably not the most appropriate person to go and do that. And so again, that's why we talked during our time together 2 weeks ago about the strategic prevention framework and how we have these processes that circle around the ideas of sustainability and cultural competence. And we have so many examples today of the importance of utilizing that model in that way. So great conversation. Thank you all. So I want to bring us back to our conversation about environmental strategies so that we can recognize the impact of these strategies and the impact that they have on our target population. And so we know that environmental strategies are complex in that they're addressing complex health problems or other community problems like substance use, but they require comprehensive solutions, collaborative solutions, so that we achieve that benefit for the entire targeted population. And I'm citing the National Center on Addiction and Substance Abuse at Columbia University. And while their name doesn't suggest person first language, they are truly on the cutting edge of some research and some innovation, of which I've cited for a number of years. So when we think about the effectiveness of environmental strategies, I really love their research because it dives into the cost benefit of environmental strategies. And one thing that I really like to share with coalitions is that individual strategies save approximately $14.53 per dollar invested in prevention. And so we're experiencing these savings based on medical intervention, based on the education system, based on judicial intervention or law enforcement, EMS calls, so different systems in our communities that are funded through taxpayer monies. That's where we're seeing these savings. And so these are conservative values because it does not take into account individual spending or quality of life, just taxpayer funding. Environmental strategies, though, save $22.76 for every dollar we invest in environmental strategies for prevention. And that's 44% higher than individual strategies. And so we know that we get, pardon the expression, a bigger bang for our buck when we engage in environmental prevention strategies. I say this while also wanting to reiterate that those individual strategies, as we have just been discussing in our conversation, are important because they reinforce the environmental strategies. So we can't enact a policy change without telling people about the policy change. That's an individual approach. However, they tie together. And so that shows us that comprehensive nature, but we are able to see the benefit of environmental strategies and the cost savings of environmental strategies as well. So I want to go through some examples. So we've talked about environmental strategies. What are some evidence-based strategies that fit within these sections that we've talked about? And so I want to walk through some examples. There are a number of resources online that we can look to. I have used some of those as basis for what I'm providing to you today, but also just in my experience, some of those strategies that have worked widely across the country in different communities of different sizes that look different with different diversity. So laws like social host liability laws, or having alcohol taxes, or restricting sales at public events, keg registration laws, responsible beverage server training, which we've mentioned today already, the compliance checks we've mentioned, happy hour restrictions. When I was in graduate school, I was tasked with collecting advertisements from the University of Tennessee's student newspaper. It was called the Daily Beacon. And in the Daily Beacon, on a daily basis, I would clip between 17 and 20 alcohol-related ads from that newspaper. And so we were monitoring how local entities were advertising to the student population. And so they would advertise drink sales or 2 for 1. And so through those norms, we were able to affect policy changes by limiting some of those happy hour regulations because of what we were seeing and monitoring in the student newspapers. There was one particular bar that had their happy hour they called Animal Hour, and the advertisement in the student newspaper was a construction hard hat with 2 huge containers of beer with straws that went down to the individual's mouth. And so that's how they promoted their Animal Hour. And you could get 6 drinks at a time. So you would order one, and then you would get 5 drinks that came along with that. And unless the coalition hadn't been recognizing those advertisements, clipping those, and sharing those with policymakers locally, traction never would have gotten moved. There wouldn't have been any movement to change some policies around those. And so sometimes we just have to look to some of those entities in our communities to recognize, again, those local conditions. The local conditions drive our work with environmental strategies. Reducing alcohol outlet density can sometimes be effective depending on your local conditions. Having graduated driver's licenses. And so if you're not familiar with a graduated driver's license, sometimes in some states, driver's licenses up until a certain age are vertical, and then when you reach the age of 21, they turn horizontal. There is some conversation and some concern, especially among lawmakers, that they might be easier to counterfeit. However, there are policies that you build in to make sure that people are continuing to look for, even if you have a horizontal ID, look for date of birth and make sure that that is well executed. Policies to limit access to alcohol or conditional use permits. There are a lot of regulations that community entities can be engaged in for those conditional use permits, so those special permits for festivals in the community. Advertising restrictions, party patrols, shoulder tap programs, enforcing impaired driving laws, cops in shops, practices that discourage shoplifting. We mentioned that earlier. Establish alcohol or food tab ratios for on-premise outlets. nuisance abatement, limiting alcohol sponsorship, safe home policies, limiting hour of sales. The list could truly go on and on. We could talk for hours about all the different evidence-based environmental strategies for limiting alcohol access. And I'm also seeing the chat box. Carlton asked a great question. If there were any strategies listed that you're unfamiliar with, I'm not seeing any about those, but also seeing a comment about wanting to make an entire street a drug-free zone to ensure children could have safe spaces near their apartment. Love that. And so this also, Muriel, ties into our conversation before about sometimes unintended consequences and how we can profile and target disparities based on our policies. And so sometimes it might be that maybe we want to make an entire street a drug-free zone. Maybe we can't make an entire drug-free zone for an entire year indefinitely, but maybe we could do it for a weekend. Or maybe we could have special times when we have special events where we make it so. And so I'm just one, I don't like to be told no. And so I like to come up with ways that we can get a yes answer. So I think that maybe there are some ways that you could identify, Muriel, to make that drug-free zone happen, even if it isn't all the time. And what we do with that is affect community readiness. Because when people in the community see these drug-free zones happening and they see families getting together and they see engagement and they see the benefit that comes from that, then that begins to change our perceptions of how we see things in the community.
Hey, Stephanie.
Yes, sir.
Real quick, if you wouldn't mind going back to that last slide again. We had a question about shoulder tap programs. Could you just give a little bit of context with respect to what a shoulder tap program is?
Yes, thank you. Thank you for whoever asked that question. So a shoulder tap program would be for if you, and again, all of our strategies are tied directly to local conditions. Right. So if we have a local condition that adolescents are asking strangers outside of convenience stores to go in and buy alcohol for them, they would, for example, come up, and we call it shoulder tap because someone would come up to a stranger in a parking lot, tap on their shoulder and say, hey, here's $20. Will you please go buy me fill in the blank, whatever alcoholic product they're asking for. And so that person would keep the change, buy the product, and give it to the adolescent. So that's why it's called a shoulder tap program. But there are ways to do some checks on shoulder tap programs when you have informants who go and tap on the shoulder of someone, asking them, hey, here's some cash, can you go buy me a 6-pack of beer? Then if that person says yes, then the shoulder tap program, it depends on your local laws and how this goes about, but you would give them a card that says, you know, you have consented to engage in an illegal activity. Here are some things that you could do to say no, and here's why you should say no. And there's a lot of things that you can do around that. But the premise of a shoulder tap program is to prevent underage people from asking a stranger to go in a store and buy them an alcoholic product. And also loving some of these ideas about Mardi Gras and the free zones, the areas that are family friendly where alcohol is prohibited. And so great examples. Thank you all for sharing those. Let's look at nicotine. So if we look at evidence-based environmental strategies surrounding nicotine, one, again, similar to alcohol, reducing outlet density, increasing the unit price, having smoke-free community policies. And so let me pause for a second, because there are many times where I talk to coalitions and they say, we're going to implement some physical design strategies, and we're going to hang up a sign that says that smoking is harmful. And that's an environmental strategy. And I say, oh, wait, time out. Let's talk about what an environmental strategy is. Because to me, a sign that says smoking tobacco is harmful is providing information. Now, a sign that says you may not smoke here, and here's the consequence, is an environmental strategy because it changes people's behavior in that area, or has the potential to. So be mindful of that as you're engaging in signage policies and signage utilization in your communities. Smoke-free parks, smoke-free car policies tobacco-free schools, which is pretty common at this point, retail outlet regulations, again, retailer training for tobacco, limiting hour of sales potentially, or restricting industry advertising. We had a great policy that was proposed by President Biden this week that the FDA hopped right on, and immediately the next day after the president's speech came out and said, we're going to work to prohibit menthol and flavorings from tobacco products. And so again, as we know, the menthol products have disproportionately been targeted to the Black and brown communities, and also increasing those health disparities. And so that's really a huge step for nicotine prevention and public health in that arena. So I was really excited to hear about that. Evidence-based environmental strategies around THC are really going to depend on your state's legalization and or lack of legalization for THC in your space. And so depending on if there's legalization in your communities or not, we could look at outlet density of dispensaries. Again, increasing unit price, very similar to some of the alcohol and nicotine policies, limiting hours of sale or restricting industry advertising, surveillance of use, countermeasures for impaired driving, and we're really playing catch up as a country with respect to THC impaired driving because of the difficulty in the field sobriety test for that. And so we have a little bit of work to do there, but there are communities that are really using some impaired driving countermeasures for THC use. We've certainly seen nationally an increase in the prevalence of driving under the influence of THC. Increasing minimum age to purchase laws, having package warning, having a universal symbol for THC packaging. So especially in areas where we have either legalization for medical use or legalization period, just having a universal symbol that a product contains THC, requiring milligram inclusions so that you know how many milligrams of THC you're consuming if you consume a particular product, having child-resistant packaging and restricted access at point of sale, banning advertising to minors, banning push-to-device ads, banning pop-up ads, banning event sponsorship, or having packaging restrictions to where the supplier couldn't use the word candy or candies, banning TV or radio ads unless 30% or more of the audience, or less than 30% of the audience is under 21. Making sure the packaging cannot appeal to children. We saw this significantly with the synthetic marijuana that emerged about 8 years ago, that they were really targeted with cartoon images and bright neon images targeting children. Prohibiting the remanufacturing of general food products is also another evidence-based strategy, so that food products could not be adulterated or remanufactured with THC in them, and then obviously restricting access in the home. Lots of theoretical evidence for THC products as well, because we can really look to the other regulated products like alcohol and nicotine to use with THC moving forward as well. And then with respect to stimulants, across the country, we're seeing that a bit of, over the last decade, we've really seen fluctuations in the prevalence of stimulant use. As Carlton rolled out 2 weeks ago when we were together, we're seeing a significant rise in stimulant use in communities. And uniquely, it seems to be tied to the pandemic, where we see this additional increase in stimulant use in many areas. And so for stimulants, again, we're looking at restricted access in the home, having structured alternative programs for youth, which you all have mentioned with respect to your drug-free zones and streets and events that you're having in your communities, having accessible and also meaning affordable quality treatment, having strategic policing. So again, when we're talking about stimulants, methamphetamine, of course, falls into this category. The policing is very different when we think about stimulants versus opioids, for example, especially those prescription opioids, having statutory requirements for disrupting meth operations. So those clandestine methamphetamine production labs, which we're not seeing as many of in the United States now as we were before we really started to enforce that. But what we're seeing now is, of course, the trafficking of crystal meth inside our border. And then also with stimulant use, this can be tied also to intravenous opioid use, is minimizing public health threats as it relates to hepatitis C or HIV, AIDS, and other infectious diseases. And I mentioned this before about moving beyond zero tolerance. For a long time in our country, we had these zero tolerance policies that if you fill in the blank, then you go to jail or you're suspended from school. Or so many of these zero tolerance policies really just reiterated and reinforced the risk behaviors and added additional risk factors. And so when we are thinking about consequences as planners, we want to be thinking about moving beyond zero tolerance. And so what does that look like? And in many circles, that looks like making trauma-informed decisions. So making decisions based on identifying, respecting, acknowledging the trauma that got someone to the place where they made the choice to cope with drugs or alcohol. And so really incorporating those ideas in our communities and identifying how we can modify the systems and the practices in our communities that have really made up our infrastructure for a long time to change things to be better for the individual. And I would argue to say that just because we've done it this way for decades on end doesn't mean it's the best way to do it. And so we can identify some new ways moving forward by also rejecting scare tactics and having prescription oversight and testing. We're seeing in a lot of communities that stimulant misuse is starting from prescribed stimulant use for different diagnoses that adolescents have starting as early as middle school and high school. And so having more oversight over those prescribed medications and testing to make sure that at a young age they're being used appropriately. And then the evidence-based environmental strategies for opioids can look very different in different communities. But again, you can see some certain commonalities that keep recurring between these different substances. But we're mentioning again, restricted access in the home, drug disposal and take back. A number of, I'll mention here that a number of law enforcement agencies are having a policy where no questions asked. Whatever you put in the drug disposal bin will be incinerated and disposed of properly, whether it's heroin or cocaine or prescription pills or marijuana, whatever it is. If you need to get rid of it, no questions asked, you can put it in the bin for disposal. Limiting the quantities of opioids that are prescribed, in addition to collaborating with healthcare professionals and those prescribers to limit the milligram morphine equivalents that are prescribed. And so a milligram morphine equivalent we identify as MME, that's the acronym you see on your screen. Milligram morphine equivalent is just the code that we use to make different opioids on a level playing field so that we can measure the amount of the morphine derivative that's in that medication. And so where, for example, a 10 milligram hydrocodone would have 10 MMEs, a 10 milligram oxycodone would have 100 MMEs. So just being able to reduce the MMEs. Again, identifying and acknowledging the stigma associated with opioid use, and also acknowledging that we don't want to inflict pain upon people, but also recognizing that sometimes the amount of milligram morphine equivalents that we prescribe in our healthcare system are more than people need. Utilizing the state prescription drug monitoring programs or controlled substance monitoring databases to track where people and by what means are people prescribed opioids, where are they getting the opioids, where are they being dispensed, and how much, what's the average MME or the MME per capita that's being prescribed are great ways to begin to limit And I'll say that in the community where I worked, we really focused in on MMEs and working with physicians and other prescribers to make sure that they were aware of what was an appropriate dose, and also alternative treatment approaches, recognizing that there are 4 types of pain. There are 4 pain pathways, and opioids are really only effective at treating one type of pain, and that's opioid withdrawal pain, which is a bit counterintuitive, right? And they opioids treat emotional pain, but we also have different types of pain that are more effectively treated by other medications. We could spend a whole hour and a half talking about the pain pathways just alone, but making sure that we have the most appropriate treatment for pain. So when we collaborated with our physicians to provide continuing medical education units for them, in a year and a half, our community decreased the milligram morphine equivalents prescribed for pain by 34%, just training physicians on the pain pathways and the effective pain treatments for different types of pain. Also, informed consent is a great strategy for preventing opioid misuse, making sure that every patient, every time, who's prescribed an opioid has a signed consent form that they have spoken with their healthcare provider that the medication they are being prescribed can lead to chemical dependence. Monitoring the patient response to the treatment. You know, if an opioid is not working to treat pain, the solution might not be to increase the dose of that opioid. It might be to try something different. And so that's how we can really work with our healthcare providers to move in that direction. Also, co-prescribing naloxone, which of course is the opioid antidote. It's an opioid antagonist that can reverse an opioid overdose with high milligram morphine equivalent opioid prescription. So if somebody has a high dose of an opioid prescribed, then a physician or a healthcare provider would co-prescribe naloxone with that medication just in case. And then also monitoring and securing strategies to make sure that people who have opioid prescriptions in their home are securing them in a locked place where they're not accessible to anyone other than the person to whom they're prescribed, and then monitoring the number of pills that they have. They should know how much they have, how much they should have, and then how much is remaining, just to make sure that it's not being trafficked or diverted. Let me pause again to see if anyone has any questions or comments to add here.
Can I just make a statement? Can we all just give Stephanie like a hand clap or some kind of a thing just to share? I mean, I don't know about you all, but she just went through that whole list, and that was something else. Honest. So great information. And is my audio acting stupid again? I can hear it. All right, I'm gonna stop. I was gonna go on, but I'm gonna stop here.
All right. Thank you, Carlton. So let's go back to examine how coalitions have implemented some environmental strategies. And I'm just going to give you some examples of some coalitions that I'm familiar with, that I've worked with. But there are coalitions all across the country that are doing an amazing job implementing environmental strategies. So this is truly just a snapshot. I blew my cover and I already mentioned this. I didn't mean to. I just got excited and ahead of myself. But this is my former coalition in Anderson County, Tennessee. And we collaborated with healthcare prescribers and patients as well to increase awareness of the dangers of overuse of opioids and non-opioid pain treatment options, because we didn't want people to suffer pain. We wanted people to know that there were different options available that were perhaps more effective at treating their pain. As a result, the MMEs prescribed for pain decreased by 34%. The prevalence of opioid use decreased by 50% in 2 years, and drug overdose deaths decreased by 38% in a 3-year period. And so significant changes associated with those environmental strategies. And again, not only did we collaborate with the healthcare prescribers, but the CMEs, the continuing medical education credits, were offered to physicians to incentivize them to come to the class. The class was offered by a physician. There were lunch and learns and grand rounds. So lunch and learns for the physicians on their lunch breaks and healthcare providers, grand rounds where a physician would go and meet the providers in the hospital where they were and just have one-on-one conversations about those pain pathways and other treatment options. Having classes for the community on pain pathways and the different types of ways that they could treat pain by using something other than an opioid, like acupuncture, like chiropractic, like massage therapy, physical therapy, mindfulness-based stress reduction, so many different ideas, and cognitive behavioral therapy as well, so many different ways that we could treat pain in our community. And so increasing access to those options. In Hunterdon, New Jersey, the coalition there promoted the benefits of insuring opioid alternatives to insurance companies by promoting the cost savings. So they did a cost-benefit analysis of how much it costs someone to be prescribed an opioid for 30 days. So we know, and there are strong data to show, that if someone uses an opioid for 30 days, there's a 33% chance that they will still be using that same opioid a year later. And so they were able to break down those costs associated with 6 weeks of, they compared chiropractic, acupuncture, and physical therapy. And what they were able to show was that the cost of treating 6 weeks of non-opioid treatment was less expensive than a year of an opioid, which we know is very inexpensive. Through their project, they increased community member knowledge of the likelihood of long-term use associated with opioid use for acute pain by 13%. They increased community member knowledge of where they can find non-opioid alternatives like chiropractic, physical therapy, massage therapy by 5%. Their long-term data has not yet been observed because they just started this project a year and a half ago. So we're not quite there yet, but their project has been very well taken and is affecting how insurance companies and providers are covering pain treatments. In Huron Valley, Michigan, the coalition there collaborated with township officials to develop a policy to limit marijuana trafficking in the town by identifying hotspots to limit access and increase policing. And so we talked about how our strategies are tied directly to those local conditions. They were able to really specify exactly when and where THC was being used in their community.
I think Stephanie, I'm sorry. I think you're breaking up.
Okay. Can you pause for a second? Is this any better? Okay, I'll start over my section.
You're fine, Stephanie. Keep going. You're okay.
Okay.
Paula, can you mute Paula? There you go.
Okay. So in Huron Valley, Michigan, through their collaboration, because they identified that specific local condition, they were able to decrease high school youth perception of risk of marijuana by 11%. I'm sorry, that should say increase. They increased perception of harm by marijuana use by 11%, and they decreased 30-day youth marijuana use by 11% as well through their policing efforts. And then finally, last example, in Roane County, Tennessee, the coalition there collaborated with the Tennessee Wildlife Resources Association to monitor boating under the influence, to reduce boating accidents and underage drinking on the water. Their local condition, because they have such a large lake in the center part of their community, is that adolescents went out on boats, oftentimes by themselves, but they went out on a boat where they were unmonitored by anyone, and they used a lot of alcohol on the boats. And so they initially increased the boating under the influence citations, one, because it was being monitored. So ultimately in the long run, they will decrease those citations, but initially, because it wasn't being enforced before, they increased. They decreased the prevalence of use reporting drinking on a boat by 30%, and they decreased underage drinking by 28%. And so you can tell just by those statistics that this coalition really articulated their local condition. They were really able to identify the behavior that youth in their community were engaged in. And so that's our real key as coalitions and as community planners, is to identify the behavior that's happening, and then we can strategize about how we do something about that. And so as we transition our conversation and head toward home base, let's talk just very briefly about investigating promising new environmental strategies, because we continuously learn more, we continuously get better. And so with alcohol, some of those new environmental strategies are using ID layover cards. So if you have a store that doesn't have point of sale software where you type in a date of birth, there are cards that you can use that lay over an ID that identify the important parts. They have to be updated every year because they have the born on date, and help the person say must be born on or before, and have the age 21 there. Additional point of sale materials like software, ID scanners, age verification calendars, increasing fines for non-compliance, having a matrix of penalties to where the penalty scales up with each successive failure, for example, in an alcohol compliance check, limiting density near schools and youth centers. This is something that's come up in our conversation today already. Limiting advertising that's seen from the street. So if we have a long stretch of bars and restaurants or convenience stores, limiting the advertising that people could see from the street unless they walk inside that building. We mentioned product placement earlier today and regular compliance checks. Communities passing mandatory ID checks, even regardless of someone's age, even if somebody is 75 years old, having mandatory ID checks, mandatory responsible beverage server training. For nicotine, again, some new and innovative approaches, eliminating shipping of vape devices, promoting the Tobacco 21 laws and regulating or enforcing those, disallowing vape devices to be returned from schools. A lot of times schools have policies that personal property can be returned to a parent if they come to pick it up. And so rolling back some of those policies and offering cessation courses for students after school. So again, moving away from those zero tolerance policies into some policies that are more geared toward how we can support young people. Installing vape sensors in school bathrooms, adding vaping to non-smoker protection policies, eliminating vaping and smoking in public parks, even if it's outside. For THC, and this could apply to alcohol as well, eliminating home delivery, replacing punitive punishments with trauma-informed approaches, limiting dispensary density, eliminating smoking. I saw one of you posted in the chat box that Louisiana was considering a bill to allow medical marijuana to be smoked. So eliminating smoking as a viable medical practice. Assigning funding to prevention from a tax structure. If you have legalization, making sure that an appropriate amount of the tax revenue from THC goes straight to prevention. For stimulants and opioids are going to look really similar, but securing and monitoring in the home, looking for alternative treatment approaches, policing hotspots, allowing treatment in lieu of incarceration, collaborating with high-intensity drug trafficking areas, requiring testing to ensure attention deficit hyperactivity disorder meds are used properly, and opioids very much the same, but providing insurance coverage for non-opioid alternatives for acute pain, and also those non-pharmacological pain treatments like chiropractic, acupuncture, massage therapy, physical therapy. Charging the dealer with an overdose death, incentivizing providers who participate in CME courses, again, incentivizing alternative pain treatment providers to open business within the community, and requiring pain management training for healthcare providers. We buzzed through some of these pretty quickly. Looks like, Carlton, we might have just a couple minutes for questions, so we want to honor your time as well. So Carlton, I'll turn things back over to you, my friend.
Fantastic, fantastic. Everybody, again, please show our appreciation to Stephanie for a tremendous presentation and amount of information that she provided for everyone. If you wouldn't mind, go ahead and give her a hand clap. Yes, indeed. Thank you so much. Stephanie, that was awesome. I wanted to just share with folks as we're coming up on time, just a couple of key points, and I'll make this quick. The first is there was a lot of information that was put into this training and that was delivered to you all. And I think we can all agree upon that. What I want you to understand is that information is intended to be digested and for you all to be able to take forward to your communities. And the way in which I want you to understand this is that on next week, when we come back together again, we're going to have an extraordinary training on media and literacy best practices for preventing substance misuse and OUD, opioid use disorder, at the grassroots level. In other words, how can we take the information of this prevention science and really translate it so that our communities really understand, buy in, or are able to take this forward? And so part of what it is that we're going to have an opportunity to do is practice and think about the great information that Stephanie offered and how we might be able to take this, digest this, particularly for underserved communities and communities of color. We're going to have that conversation on next week. So I am grateful for you all being here. If there's any question, please let me know. Let us know if you have a question, please raise your hand right now. I want to honor everyone's time. I want to say thank you to Leslie, and thank you to Dr. Harrison, and thank you to Amber and Felicia and Dr. Janice, wherever she is. I want to thank everyone out there who was responsible for putting this together, most specifically, and I'll now turn this over to Paula for any last statements that you have to close us out. Dave and Stephanie, thank you both for tremendous work today, and thank you for being a part of the team. Really appreciate the effort. Paula, it's on you. Yeah, no, it's not working.
I'll just say the closing for Paula. Be sure and contact her about your
Dave, you, Paula. Thank you. Go ahead, Dr. Harrison.
Oh, no, I said on behalf of LCPR, we want to thank you and just contact Paula through email for your CEUs if there's a question. And did you want to say something about the evaluation?
Yes, thank you. So you will be receiving an email from us after this training. You should look for it within the day, but you'll receive an email from us for the evaluation. It will also have, and we're going to make sure that you're able to be provided with a link to the video of this training, so you'll be able to access this training and offer this training to other members of your teams and your coalitions who weren't able to be here. So we'll be able to provide that for you all. And so look for that email from us and look for the information in terms of the next training. We'll be sending that out soon.
Thank you. Thank you. And see you next week, Carlton.
Thank you all. God bless everybody.
Have a great weekend.
Have a great weekend. Thanks.
Hey, Summer.
Thank you.
Thank you.
All right. I feel somebody's going to say goodnight, John Boy. I know it's coming. I know
Dr. Harrison, I miss you.
Marilyn, I miss you too. And Marilyn, it was so good to see you. Okay. Look, so good night.
Yes, good night. All right, thanks.
Good night, Mary Ellen.
Bye-bye, everybody.
Good night, John Boy.